Hi, welcome to Medic Without Jargons. Today, I'm going to deal with a topic that is very common in pharmacies. As a pharmacist, this is something that I get asked all the time. The question is, what happens when you have missed a dose of your medications? You see, people ask me all this all the time. People panic, people get worried because they have missed a dose of their medication. All I will say is, before I go into it, there are so many things I want to talk about, but the first thing I want to say is do not panic if you have missed a dose. So from my own perspective and from my own experience, what I will ask is, what kind of medication have you missed a dose of? How long have you been on that medication? At what cycle are you on? In other words, did you just start that medication, or is this something you've taken for years or months? And also, the next question is, how often do you take it? Do you take it every day, once a day? Or do you take it once every week? Or is it something you take twice a day? So these are the factors to look at when you're worried about whether you have missed, what to do when you have missed a dose of your medications. So one thing I would say is, you do understand that for certain medications like antidepressants or blood pressure medication, the prescriber or the information will say, do not stop taking this medication. It doesn't mean that there's an issue when you have missed a dose. But what I'm trying to tell you is that if you have missed a dose, it's not the end of the world. But what you don't want to do is to stop taking that medication, because they are meant to be doing something. Now, when you take each medication, it does something that we call building up to the peak, to the highest level. And some medication takes a week to get to the peak, while some medication takes weeks before you get to the top of the peak of that medication. So what I would say about missing a dose is, if you have missed a dose of medication, the first thing you need to do is, like I said, do not panic. The second thing you need to do is, whatever you do, inform your GP or your prescriber or your physician that you have missed a dose of your medication. They need to understand that you have missed that dose. Now, the second thing I want you to do is to contact your GP and ask him, what should I do? Or contact your pharmacist. The thing is that if you're meant to be taking medication twice a day and you have missed a morning dose, it's not a good idea to double up and say, nah, I'm going to take two because I've missed the morning one. No. If you have missed one in the morning and you just remember that, hang on, I've missed this one, and you only found that in the afternoon, forget about the morning dose and take your evening dose. Also, if it's a medication you take weekly, some people are on injection medication for weight loss, which they have to use weekly. The question you need to ask yourself is, at what point did you miss that dose? Assuming you're meant to inject every Tuesday and you have missed it on that Tuesday and you remember it on Wednesday, what do? My advice is, you can go ahead and use it on Wednesdays and carry on the following Tuesday, the following week. But the key is to remember that you need to inform your medical professional that you have missed that dose. But what I don't want people to do is to panic and say, oh, I have missed this dose, what am I going to do? Now, where there are issues with missing dose is if they are contraceptives. What do you do if it is a contraceptive? That's a bit dicey, because the thing is, your contraceptive medications are meant for protection from getting pregnant. So if you have missed a dose of a particular contraceptives, the question is, number one is, what type of contraceptive is it? That's number one question you have to ask yourself. Number two question is, how long have you gone without taking your medication? Because some of them, so far you have a 3 hours window, you're fine. And some of them, so how you have a 12 hours window, you're also fine as well. So the issue of missing your contraceptive is dependent on what kind of contraceptive it is. And also it's dependent on how long you have missed it for. Just bear in mind that if it's a medication or contraceptive you're meant to use within a 3 hours window and you have missed that 3 hours window, there's a high possibility that you're not protected if you decide to have sex or have unprotected sex within that period. So you have to find that extra precaution for the next 1 week or thereabout. If it's something that you have protection over 12 hours and you have missed a dose, so far it's within that 12 hours, then you're still covered and protected. There's no harm in also taking extra precaution, but knowing the window of safety helps you to know that you're all right, that it's not the end of the world. So the key, like I said at the beginning, is number 1, do not panic. It's not the end of the world. Things can be rectified. And number 2, just bear in mind that if it's a contraceptive, please contact your medical health professional to find out how far you have missed your dose or what you can do. Now, in terms of medications for depression, antidepressant or blood pressure medication, or even cholesterol medication, people say, oh, I have missed it. I've missed my antidepressant for 2 days, or I haven't taken my blood pressure medication for 2 days. That's not a good thing to do, to miss for 2 days. But the truth is that you have had to take those medications for weeks and months to build up the level in your system. Because you have missed it for 1 day or 2, doesn't mean all of a sudden the whole thing will come out from your system. There will be some level of control of your blood pressure. There will still be some level of control of your mood if it's an antidepressant. But what I would say is that once you have found out that you have missed a dose, what you need to do is ask yourself, when am I meant to go back on the dose? In other words, do you take it every morning? If it's something you take every morning and you missed it for 2 days, on the third, once you found out and you got your medication, go back taking it as normal. Because gradually, though you must have fallen off a little bit on your system, it will get back on your system and the system will normalize again. If it's a blood pressure medication, my advice is check your blood pressure. What level is it at? Has it peaked because you have missed it for a few days? The chances are that they might still be all right. But if the blood pressure, even if the blood pressure have sort of spiked a little bit because you have missed the dose 2 or 3 days, it's not something to panic about. All you need to do is to inform your GP and also get back on taking your medication as normal. Thank you for watching, and like I said, please, missing a dose of a medication is not something to panic about. Share with your friends, share with those who are worried, and let them know that yes, it's bad to miss your medication or to miss a particular dose, but the key factor there is that you should not panic and you should get back on your normal routine going forward. Thank you for watching, and goodbye for now.